All right, we're on recording 8 for women's health. We're going to talk now about some risk factors that we would need to assess for when we're caring for women. We want to look at social, cultural, and genetic risk factors. Know that socioeconomic risk, that means poverty, um, increases the risk of perinatal and maternal death, increases the risk of preterm birth, and increases the risk of low birth weight babies. There are also racial and ethnic disparities in care and outcomes. Those have been well documented. One example, there are disparities in maternal death for Black women. Black women are more likely to die in childbirth than other women in the US. And that's true even when controlled for socioeconomic factors. So even when poverty is removed as a factor, Black women are more likely to die in childbirth. There actually have been some major political moves based on that understanding. So be aware that there are some racial disparities in care and outcomes. There are also genetically linked illnesses that some of which affect reproductive health, and single parenthood is a factor. Parents who, if a parent is the only parent, they are more likely to be, actually, let me go back. Single mothers are more likely to experience poverty than mothers in relationship. I don't know if that's necessarily the case for single fathers. We need to assess for substance use disorders. There are, we used to believe that there was genetic predisposition to substance use disorders. Now that's very, that idea has been questioned, and we're not sure that that's the case. What risk factors there seem to be now for substance use disorders are stressful life experiences coupled with a lack of resilience. And I think that the last couple of years with the pandemic has kind of borne that out, because substance use disorders have increased greatly with the increased amount of stress. It's as if we have a threshold of stress, and that's fairly individual. And when we get past that threshold, then we're more at risk for some inappropriate coping mechanisms or some self-harmful coping mechanisms. Poor social support is also a risk factor for substance use disorders. So that's another stressor. Sometimes family and friends who should be the support system actually are another stressor, tilting people toward negative coping mechanisms. We need to assess for nutrition problems. There are people in the US with food insecurity. There are people with calorie deficiencies who just either don't have access to or don't consume enough calories, but we have a lot more nutrient deficiencies in the US. And protein deficiencies are still common in people with lower income, because sources of protein tend to be more expensive. So when a family has food insecurity, a large proportion of their food intake may be from lower quality sources. So they may take in enough calories or even excess calories, but a lot of those calories may be foods that are very starchy and filling, but don't have a lot of nutrients and maybe inadequate protein. Obesity is an effect of several factors. Obesity is not a behavior, and it is not the problem itself. It is a result of the problem. Weight is calories in, calories out. But we have a lot of differences, individual differences in the way calories are spent individually. So once someone has developed obesity, it can be very difficult to return to a a target weight range without doing some pretty unhealthy things. So what we want to look at is, are we looking at the risk of obesity, or are we looking at the risk of the behaviors that lead to obesity? So if someone is obese, we want to make sure that we're giving them recommendations for healthy eating and exercise, not lose weight at all costs. There are weight loss surgery has increased in the US in the last couple of decades, and there are a lot of people who've had really good success with that. Weight loss surgery in people who are morbidly obese has been shown to decrease some the risk of heart disease and diabetes, and now the risk of serious complications from COVID, the risk of death from COVID. But early weight loss surgeries actually led to a lot of nutrient deficiencies. Radical weight loss surgery now still does lead to nutrient deficiency. So patients who've had weight loss surgery need some teaching on how to get adequate nutrition. We also need to assess for eating disorders. Eating disorders are psychological disorders that have negative effects on nutrition. We think of eating disorder as someone who is very, very thin and is either not eating or is binging and purging, or a combination of both. But someone with an eating disorder may be underweight, normal weight, or overweight. People who are overweight and have disordered eating are frequently encouraged to continue that disordered eating because it causes weight loss. So we need to make sure that we're assessing nutrition appropriately. We need to assess for lack of exercise. That's another risk factor, not just for obesity, but also for a lot of other health issues. The risk factor for diabetes and for high blood pressure and for cholesterol imbalances. So we want to assess for exercise, assess for stress and how that person manages stress. We want to assess for mental health conditions, depression, anxiety, assess for sleep disorders. Environmental and workplace hazards as part of your assessment of a patient. You should be asking, where do you work, where you live, what kind of things are in the environment. When we talk about reproductive health, there are specific environmental exposures that can affect reproductive health negatively. We want to assess for risky sexual practices. Patients who have more than one partner are at greater risk for STIs, and there are things that they can do to reduce those risks. Okay, using barrier methods with every encounter reduces that risk significantly. So rather than judge, we need to be assessing risk and giving information for how to mitigate that risk. And we assess risk for specific medical conditions. In the past, most women of reproductive age have been healthy, but chronic illness has been rising in young women. Our society has become more sedentary, and our food sources in the US have become more and more unhealthy. And so chronic illness is rising in young women, which is affecting pregnancy. Health habits and risk factors in the reproductive years, even if we don't have effects at that time, they increase risk for later. We want to assess for the risk of gynecologic conditions like cancers. That's what some of those screenings are about. We want to assess for someone's risk of developing STIs and other infections. Assess for symptoms of uterine fibroids or other anatomic problems with the uterus. Assess interstitial cystitis is an underdiagnosed condition that mimics recurrent UTI. The lining of the bladder becomes inflamed and it just stays inflamed, so that person has UTI symptoms chronically. So if you have a patient with those recurrent UTIs, refer them or consider referring them to be evaluated for IC. And pelvic floor relaxation. The pelvic floor is a set of muscles that's like a figure 8 with an extra loop. Okay, and it loops around, it circles around the urethra, the vagina, and the rectum in women. Okay. Men also have a pelvic floor. It circles around the rectum and the reproductive organs and the urethra. And when that muscle is weakened, it causes or it allows the organs to kind of prolapse. The rectum can collapse in toward the vagina. The bladder can collapse in toward the vagina. And that can create some issues with elimination. The vagina can prolapse downward, sometimes all the way until the cervix is actually visible. That is very uncomfortable. And the pelvic floor muscles also provide support for the urethral and rectal or anal sphincters. And so pelvic floor weakness is a really common cause of or contributor to incontinence. So pelvic floor relaxation is something else we need to look at. And we need to be assessing for family violence, in particular violence against women when we're talking about women's health. Okay, so we're going to look next at some common reproductive issues, and we'll be starting with menstrual disorders in the next section.